Welcome to the Security Equation podcast, where we break down what it really takes to protect people in complex environments. Today, we're talking about a critical and often overlooked piece of event safety, the intersection of medicine, security, and crowd management. Joining me is esteemed Dr. Andrew Bazos, founder of CrowdRx. He's built one of the country's leading event medical platforms designed specifically for high-density, high-risk live environments. We'll dive into how he got here, what he saw missing in traditional event medicine, and why security and medical teams must operate as one unified system if we're serious about preventing, not just responding to incidents. It's an important one. So, Dr. Bazos, thanks for joining us. I really appreciate you taking the time.
Thanks for having me, Dan.
You know, let's go way back. What originally drew you into medicine?
Medicine was an area that combined my strength in science, my interest in science, with my like for being around people and being social, and they combine well there. You don't have to be social to be a good doctor, but it's helpful, and it's a hell of a lot more fun.
And what's your specific practice?
I am a board-certified orthopedic surgeon with a specialty in sports medicine, knee and shoulder surgery. And that's an area where you have healthy people that are moving fast enough to get hurt. And it's a good group of people to operate on because they generally have the desire and the body to get back after a surgery.
But you took a practice, you know, where you're in surgery, getting athletes, amateur, professional, whatever, back to the court, back to the field. And then you got very entrepreneurial and said, there's something missing here in the event space. What led you there?
Yeah, it was a bit lucky. And I wish I could say I had this brilliant idea and I saw this big gap early. I saw it later. I trained at Columbia-Presbyterian in the city, about a 3-wood from Yankee Stadium. And one day I was working in the emergency room, and a Walt Disney employee had been injured after the 8th inning during a fireworks show at Yankee Stadium. She had a head laceration, and I heard it was coming from the Yankees. So I rushed over and I gave him the red carpet treatment and sewed her up. And the Yankees, and at the time, my boss and still one of my close friends, Bill Squires, was head of operations there. I'm sure you know Bill.
Bill very well.
He's an icon in the industry. He came down and met me, and he gave me 4 tickets to the California Angel Yankee game. So that tells you how long ago that was. It was the early 90s. I wrote him a handwritten thank you note because my mom always taught me to do that. And he called me and had me come in, and he said, I don't like the doctors here. You're going to do this next year. And at the time, I was literally an intern. I wasn't even licensed yet. And of course, I said, absolutely, I'm in. He gave me the schedule for the next season. I went to my program director, and they were thrilled to have a relationship with Yankee Stadium. And the next year, I took it with a couple of buddies. One of the big drivers back then was we were getting paid less than minimum wage in training as doctors. And I was paid $150 and given 2 seats to sit at a Yankee game. And as a big baseball fan, even though I'm a Red Sox fan, was huge. So I would study, watch the games, and it worked out great. I kept my eye on the ball. And then there was an MSG TV interaction with MSG, the venue, the Knicks and Rangers venue. They recommended me down there, and then the rest is history. But it was a different kind of coverage, as you know, back then.
Yeah, I mean, you're providing probably more team services then, or was it crowd related?
No. To the contrary, the team doctor was he was a professor at Columbia. He was a friend of Mr. Steinbrenner's at the time. And we had a common background, so I worked along with him. But my main job, and I use that loosely because I didn't do a lot back then, and we can go into that, but my main job was to organize, to have a doctor there to meet the public requirements for a large gathering, which said you need a doctor if you're going to have over 40,000 people.
Right.
But the world was different then. You would park an ambulance outside and have walkie-talkies and something happened, you called the ambulance guys in, and that was it.
So you mentioned the gap. When you figured it out, like, what was the gap and what led you to CrowdRx?
Well, like many things, change promotes more change. And a couple things happened in my second or third year, and it fortunately didn't happen to me, but there was a high-profile case with a slow response time to someone having a cardiac event at another venue that I knew about. And it got me thinking, gosh, we really should be a little more strategic, like a football team, and position our guys on the right levels and spread them out. And oh, by the way, what about the defibrillators? Who's watching those? The Yankees weren't watching those. And so that's sort of spurred me to take it a little further. At the time, the regulations were very loose. To get 50,000 people together, all they said was 1 doctor, 3 ambulances, 6 EMTs, and they I think they still haven't changed. Right. The second thing that happened that really spurred a lot of this for everybody, and I'm sure on the security side as well, is the advent of smartphones. So before, anecdotally, gosh, they took a long time to show up, or they didn't move me the right way, or they went to the wrong exit. Now we're being filmed from 17 directions. If you're reading a book in section 315, row 4, there's security guys that are reading that book along with you. So it really had to be on our game to make sure that arrival times are appropriate, chain of command, communications, and then the sophisticated systems that you know about interfacing with security and venue operations.
That cardiac at the football, that wasn't in Santa Clara, was it?
It was not in Santa Clara.
I was involved in the opening of that stadium, and we had that exact scenario. The response time was great. We didn't have the elevator program for lockouts.
Yep.
And this individual ended up on the freight elevator with medics working on him. Yep. And went up instead of down. And it's one of those learning things when you open a building. Not all of those kinks and programming and everything is in place. So it was an interesting thing to observe, right?
We've done a good job in the Yankees. I have to credit the Yankees, which is my legacy client. Doug Behar is there, has been my boss there for a long time, and we've become close friends. But he has made it a point every spring, even when the weather's bad, to go out, and we do 3 scenarios at different parts of the park, unannounced, with full teams there, and that kind of practice and preparation has been really key. And he's also been very good about telling us that you need to make sure everything medical here is correct, even the things that I don't know about, because for lack of a better word, the suits that run these places, they have their lanes, and they really don't get the medical lane. And I really try to make these venues and venue operators understand that part with mixed success.
Well, and that's evolved a lot, right? Because if you go back in time, security had their lane and medical had their lane. Yes. And I think there's still opportunity to improve that integration between security teams and medical teams. How have you found that integration over time?
Well, you said it well with the lanes, and the analogy I always use is a baseball analogy. Security is the center fielder, and medical is the right fielder, and the ball's hit in the gap. Yeah. Who's going to lose there? If you're not on the same page and have a plan, have a cutoff man, et cetera, there's going to be harm to the patient. So it could be a response time because command center did it wrong. It could have been a paramedic, didn't know the building, or was somewhere else. Everybody has to cover each other and work as a team. And the people that exploit that, as you know, when it doesn't go well, when the elevator doesn't work, when the paramedic went to the wrong section and TV documented in the stadium, cameras get subpoenaed, the lawyers come in. And
Yeah.
it's not about being afraid of liability. It's ultimately about giving the best patient care, and that means a team. What I've tried to do to alleviate that or ameliorate that is to get the guys, our teams, to know the security guys. At the Garden, I instituted pre-event meetings, and we send a staff member there. Just laying eyes on somebody and saying hi is that's all it takes. And when something bad's happening, knowing that face, that guy that was nice to me before in a tense situation is my friend. So that's been a big part. And I found, again, venues institute that inconsistently. Some are great, some are not.
Well, it becomes even more difficult in those special event venues. We work with your team a lot in San Francisco at the Moscone Center, and we know where the medical offices are. They know where they are. But now we overlay this whole different terminology because we're not calling that hall. It's not Hall F, it's the keynote room. Or it's not, the XYZ space, it's the expo. And then I got to direct your resources into we're near a booth that's got a sponsor name on it. Well, right. I don't know that sponsor booth, and your team doesn't know that sponsor booth. So trying to get our teams on the ground to communicate exactly where are you so we can get you the right resources in as timely a manner as possible is part of that pre-event exercise now that we go through.
Right. And if you think it's hard in a fixed venue, try it in a stand-up venue in a farm field in Iowa, right. Where everything is new. You don't have sometimes passageways. You have temporary staff coming in, even medical. It's even more important in that setting. And then obviously the ultimate challenge in more austere settings like Burning Man, where there's just no reference points.
Right.
And harsh weather conditions. So it's a good challenge based on the venue.
We'll come back to some of that stuff. I'm really interested in kind of the business side here. How you scaled this business. I remember when CrowdRx started, and I knew of you. We met a couple times. I knew Kirk Randazzo at MSG and Paul Padilla, and they spoke very highly of you. You scaled CrowdRx into a national or maybe even an international company that's providing these medical services for all types of events. You just touched on the special events from the fixed venues. What were your challenges in scaling and some of the stuff that other entrepreneurs might consider?
Well, I really was stymied as we tried to spread out nationally because we're not one country. We're 50 countries. And if you break those states down into counties, we're a lot more than that. I have a colleague that does this in Amsterdam where there's just one country, one set of rules.
Yeah.
Here, we needed licensed people on the ground everywhere we wanted to go to. And I immediately recognized that there was one preeminent EMS company out there by the name of American Medical Response. It's now Global Medical Response. And I said, if we could team up with them, they have the shelf space throughout the country. They have the assets that I need because I'm literally just a doctor. And we could create a playbook that we could reproduce all across the country. We could go into existing venues where they worked and make them better. And ironically, or not ironically, the more venues we got, the more experience we got. We took a data-driven approach to our coverage, so it made us better. Just like if I do, 100 rotator cuffs, I'm going to be better on that last rotator cuff. If I hit 100 serves, my last serve is going to be better. So the more we did it, the more data we got, the more we were in demand. Because when you're setting up, let's say, Electric Zoo on the hot asphalt in New York for 70,000 kids, 18 to 24, with alcohol sales, we knew what to expect in terms of manpower, what we needed in our tents, what we needed for doctors. The other thing I recognized early as an orthopedic surgeon who used to sit at those Yankee games, my skill set of setting bones is not really that important in the setting of an acute emergency. The real life-saving events are cardiac, they're respiratory events, head trauma. So early on, I made the decision to stop using orthopedic surgeons and move quickly to emergency medical doctors,
right,
which are prepared to give the same care you get in the emergency room at the venue or at the farm or wherever the event was taking place.
Yeah. Well, talk about the risk and the liability that you took on in doing that.
Sure. It sounds it sounds riskier than you would think. Liability in the medical world is making sure that you are conforming to the standards of medical care. So the public expectation when they go, let's say, to an EDM concert in Ohio on a farm, and you send your kid there, you expect to have first aid on the property. We found that by going 3 or 4 times above that level, it's very hard for anybody to say we're violating the standard of care. We were setting the standard of care and we were exceeding the standard of care. The other thing we adhered to, there's something called the corporate practice of medicine that a lot of venue operators don't know. That says that if you're providing a doctor to an event, it has to be a doctor-owned company because a doctor is bound not to making a profit. It's nice to make a profit, but a doctor is bound to his medical expertise and to providing adequate and above adequate level of medical expertise to the site without a business decision. So I'm not going to get a cheaper defibrillator so I can make more money because I know that's not good medicine, and I'm on the hook for that. My license is on the hook for that. Right. So that's why we take that approach at all of our venues.
You touched on EDM and some of those, those big events that have a younger demographic. It's a completely different challenge than a Yankee Stadium or a Madison Square Garden. The attendee profile, the drug influence. Talk about the difference of what you had to prepare for. And I think you've actually been involved in the industry to help them with standards and to improve, what we were seeing when some big events were getting canceled because of drug distribution at their events.
Right. I think a great example is what happened with us at a Live Nation venue in Washington called the Gorge, which is a beautiful setting over the Columbia River in a very remote area of Washington, where they have a beautiful little community and a little emergency room that serves all the families in town. And then come the summer, you have 3-day festivals come in, EDM festivals. You have country music festivals. You have camping. Camping, as you know, is a whole different animal. So you have people living there for 3 days, oftentimes in extreme high heat conditions that are taking care of themselves poorly, and they're getting infiltrated with recreational drugs that don't always go along with those conditions.
Right.
So what happened at this Live Nation event, they were starting to flood the emergency room with patients coming from the event. And basically anybody got sick or had a spike of temperature or their blood pressure dropped, they're getting in an ambulance and being presented to this tiny emergency room. And that's now going to compromise the care of the community. And that's what communities do not want to see. That just can't happen. So Live Nation was looking at having a surcharge put on their ticket to pay for extra personnel at the emergency room. About that time, I had come up with this plan to keep more people on the site by bringing the medical care to the site. That's something you can do now because technology has gotten to the point where equipment is so much smaller. It's so much more affordable. Right. Doctors are not cheap, but you can get an emergency medicine doctor there for a pretty reasonable price. And you're better off getting sick at a concert than you are at your house now.
Right.
Because all the care is there. And when you think about it, Dan, what the bad things all happen within a few minutes. And even if the hospital's next door, By the time you put somebody in an ambulance, they get signed into the emergency room. You may have lost your treatment window. So very quickly, we turned around that Live Nation problem. The emergency room was spared, and patients got better care on site.
Right. Let's talk a little bit about the intersection of, medical security and then crowd management. How involved does your team get involved in that site planning? You talk about temperature, these different situations. Is the medical team getting engaged in kind of the safety side or the crowd management side of the event yet?
We should be, and some of the great promoters get it, and some of the new promoters don't. One of the problems we run into, and this is a business issue, medicine is viewed as something that the cost of what we provide drops your profits.
Yep.
And nobody likes to hear about that. We're often sort of in the background, but I think the good promoters realize that they're going to lose a lot more profits if they lose a venue, if they lose a concert series, and they're doing the right thing. So we push sometimes to get involved, and a lot of times either the municipality or the promoter will bring us in early. Again, we have expertise that can even help on the security side. We know what we're going to expect. If you tell me the age, alcohol, the venue site, the population coming, the length of the event, and the ambient temperatures, we can put that into our formula and have a pretty good idea.
Right. I think we need to be more data driven in so many different aspects of the event industry.
Yes.
This being one of them. Was your team involved in Astroworld?
We were not, and that's a good example of where I think that there were several breakdowns. Medical got caught behind the 8 ball.
Yeah.
And security, you're that side of it a lot better. And I've read through I've been asked as an expert to look through some of the paperwork in that matter, with the hopes of, making it better next time, not allowing that to repeat itself.
I was involved post-event as an expert witness and read through countless hours of depositions and watched a lot of the video. Looking back and trying to take those lessons, from a medical perspective, from what you've read, what's available, what would be, the top 2 or 3 things that you would have recommended to have in place? And let me be more specific. When those first, calls happened and they were at the frequency that they were, what would medical's role have been in stopping that event?
That is a loaded question. We pride ourselves on being involved and giving recommendations. And a lot of the municipalities, we have software now that give real-time reporting. So they know if the medical certain diagnoses are showing up a lot, and we've stopped events. Electric Zoo was stopped by the mayor many years ago, early in my career. But events get stopped for many reasons, for weather, for epidemic type presentations during the event. There could be a bad drug out there, et cetera. We can only do so much. And as you know, from going through that paperwork, there were people that wanted to stop that event. Yeah. There were people that recognized it early. There were chain of command issues. When you're in the middle of the fight, sometimes the decision making that should be there wasn't there. And medicine is still, at the end of the day, ancillary to the entire running of the event, which is done by, people like yourself or venue operators. And we can only do so much. Right.
If you had to just outline generally, if there were top, 3 things that you would like to change in the industry, or organizers better educate them when it comes to planning medical coverage, what would they be?
One is look at regulations and make sure you're hiring properly licensed people and you're following state and federal guidelines. Again, I point to that Corporate Practice of Medicine Act. You don't want to hire the cheapest company. The cheapest company may be using independent contractors when they should be employees. They may not being run by a physician who has a duty to provide the best medicine, not the cheapest, most profitable medicine. I find when we speak to different venues about growing into them, that they don't really understand that liability until something bad happens, and then we get the call. So I think from a venue operator or promoter side, you really need to stop looking at medicine as taking away from their bottom line, but more protecting their ability to continue to earn and entertain. As doctors, I view all our patrons as our guests to our venue. So when your guest comes over and they're not feeling well, you take care of them. And I think that is lacking in some places. We're lucky. We work at great places. You know, the Garden is super, the Yankees, U.S. Tennis Open. But it's uneven across the country in some areas.
Yeah. It's an interesting intersection because, you know, look, we're both in the cost of goods sold, not the revenue generating side of the events. But it's the insurance, right? It's the insurance, as you said earlier, that you're allowed to run that event again next year. Because
and I think you mentioned the three things you asked me about. The second thing, I would like the insurance industry to recognize the drop in their exposure when they have a data-driven company like GMR, CrowdRx there, because if something happens and CrowdRx was there and this is all they do, it looks a lot better. Things are going to happen no matter who's there, but at least you did everything you could to mitigate any of these disasters. So I would love that venue to get some of that money back for having a premier medical system on site. The same way if you have fire detectors, you get a break in your insurance. I think that should be out there more.
Yeah. Have you gone down that path with any of your clients and their insurance carriers?
I have. I can break through in some areas, but I'm still viewed as the doctor, and I'm not supposed to know any of that stuff, but I do. So if anyone's out there, I would like to stop wasting money on insurance or the crazy premiums and get credit for paying for in-house care that exceeds that of the local emergency room. We have amazing doctors that work for us. The GMR backing has 40,000 first responders and all the toys, planes, ambulances, redundancy. Things happen, an ambulance shows up late, or there's heaven forbid, a mass casualty. We have extra assets now backing us through Global Medical that can fill that gap and make us stronger and better and safer.
It's a really good point. We've gone down that road before, and I just get frustrated. My assessment is they should at least get better coverage. They may not get rate reductions, but at least they should get more for what they're paying for. Because look, the insurance company's revenue is that premium.
Correct.
But at least they should get better coverage because they have these services in place to reduce their liability and their risk and reduce their claims.
It goes without saying. And I'd love to work on breaking through. There should be a playbook for your venue. If you're running a 70,000 venue in Kansas, we know the temperatures, we know the demographics. Just make sure you're doing everything evenly. Even within the leagues, NHL, NBA, NFL, there are a lot of inconsistencies still. Yeah. So if you're playing in venue A versus venue B, are you going to have a paramedic response to the field? Are you going to have a separation between the team that covers the stadium and the team that covers the field so that assets aren't fought over in the case of an emergency? All those kind of issues. That's another thing we try to do is keep our field response team separate from our stadium response team.
I should probably know the answer to this, but I don't. The leagues, NFL, NBA, MLB, they have best practices for security.
Yes.
do they write best practices for medical at their venue?
More and more. And I think the NFL is taking the lead. Understandably, the high impact sports have a higher risk, and that they've done a much better job because of that push. Baseball, basketball, hockey can have high impact. I found that the NFL is taking a good lead on that. The other thing we worry about is not impact related, is cardiac abnormalities that lead to cardiac events in otherwise young, healthy participants. There have been many disasters in sports. Basketball is pretty prone to that. So we have a paramedic stationed on the court for quickest response.
Specific to the athletes.
Specific to the athletes, yes.
Yeah. It's tragic. I can't even go down that road having young athletes that in their 20s now, but I saw that happen in high-end youth basketball. It's terrible.
Yep.
Let's just touch on data again. What's the reality of real-time data and the availability, and how should event organizers and cities and communities be accessing that data to ensure they have the best plans available?
Well, again, that's the value of having a high volume sports entertainment coverage enterprise and having a parent company like GMR who can spend the money on software. We have amazing software now that all of our providers get. They have iPads or on their phone, and they're entering data real time, and the municipalities are following it real time and looking for patterns and looking for issues that may stress the system. That's been sort of a godsend, and in many places are mandating it, rightly so. When we're historically in remote areas with bad Wi-Fi or bad cell coverage, Burning Man is a good example in the middle of nowhere in Nevada, was a little tricky. That's gotten better with some of the technology out there to provide, local high-speed internet that doesn't get swamped. I'm sure a few years ago, if you're watching a Knick game and you want to, text your wife that you're going to be late home, that was impossible.
Yeah.
And then you just get yelled at when you get home.
Yeah.
So that's better now.
But I assume that can go to the simplest of scenarios, a foodborne illness, something is happening, and you're able to track trends a lot better than we've done in the past.
Yes, I think that it's most important in the setting of a potential recreational drug that gets in mass quantities. As you know, at these festivals, if you get a dealer in there, they're dropping medicine, they're dropping pills in with drones, they're burying them, a month ahead of time. And if you get a bad batch of something and these kids are coming in, we've had a couple of those events, they're coming in with temperatures of 106, 107 degrees from reactions. That's when things need to be shut down quickly.
All right, I'm going to show my naivety here.
Mm-hmm.
We're involved in the screening of guests. We have a company that just does that, and it's, the advanced AI and all that stuff. And it makes for a great entry experience. It does not address that situation that you just spoke of and that guest that's going to bring those drugs in, or the guest that's going to use those drugs, because we're not searching bags. The bag can come through. Where does the venue operator, the event owner's liability lay in this? My stubborn attitude is I'm providing a very safe and secure environment, and you as an attendee are choosing to harm yourself with some sort of recreational drug or a drug that's distributed there that you know nothing about. Where does the liability really sit? Is it the event owner? Is it the individual?
Well, yeah, I think this is largely a United States problem. I think everybody, we have a problem taking responsibility for ourselves. There was always, and again, we're a litigious country. There's always somebody else to blame. You don't really see this in Europe. You don't see it as much in Australia, although they're starting to catch up. So everyone's looking for somebody to blame. Why didn't you have bomb sniffing dogs? Why didn't you have drug testing? They want recreational drug testing on site because my kid could have. They'll find anything they can. And if you do put it on site, well, why did you have drug testing on site? You're sort of tacitly condoning drugs if you're doing that. So it's really tough to find the right answer on that. I personally think we're all responsible for what we put in our bodies or what we do to our bodies. I think as a host of an event, you're responsible for not having, kids jump up and down on the couch. So you shouldn't be climbing things. You shouldn't be overserved. You shouldn't be squeezing into areas and stopping egress for other people. All those things I think the venue is responsible for. But those smaller decisions, and they often, unfortunately, involve, recreational drugs, are on that person as much as everybody tries to offload that liability.
Yeah. It's such a catch-22. It's because of our litigious society, as you mentioned, right? I hosted.
It drives so much.
Yeah, now it's my fault because I had the event. You talk about testing. Let's look back 5 years. I think is about the right time frame. We all went through a period of COVID, and the event industry really, took a very serious hit from an ability to host events. And then we came back, and you're in the middle of this because you're coming up with solutions for venues to actually have events during a pandemic. We were in a similar situation with the NCAA. Look back, what did we get right? And what did we get wrong?
Well, I remember being we had the Big East basketball tournament at the Garden, and it was halftime and we were getting some food, and then they just said, that's it, it's over. And then we went into the state where at that point we thought it was going to be a short shutdown. I remember giving a talk to the Yankees saying, this will be over in a couple of weeks. Spring training is going to be fine. This was 4 people died in a very populous city in China. So we had terrible data and we missed the ball early. And then politely say the game started. How do we protect people? How do we get people all together again? That 6-foot rule came out, which was silly and pretty arbitrary. And then obviously COVID testing in the form of the nasal testing, the deep swab, the shallow swab, then the thermal cameras. And we were talking before about how Connor Fitzpatrick, who was the sort of the water behind the CrowdRx tree, said, hey, this thermal testing is a big deal. And we went to our bosses at GMR and said, Randy Strozik, great guy, by the way. And we said, Randy, we need to buy this $7,400 camera. And we have to have it shipped tomorrow from China or Japan or somewhere. And he's like, you're crazy. For what? I said, it's going to be great. We have a client. It was a San Francisco client, and they want to use it, and they'll pay us that much. And then we get to keep the camera, and we can use it in other places. So we were one of the first groups, again, thanks to Connor, to order these cameras. They were optics. I mean, you walk by, your face turned red. If there's a breeze or the ambient temperature affected it, but people wanted to feel comfortable,
right?
And allow business to continue. I do think we shut things down for too long. I could probably be flagged for that, but better safe than sorry. We didn't understand it. The one thing I think that was important was keeping people at risk away from this disease.
Right.
But you don't go to a Rolling Stones concert if you're at risk in a period of COVID or immediately post-COVID. Again, back to your self-responsibility thing. Is it grandma's fault that she went to see Neil Diamond and got COVID? It's on her. It's on her kids. It's not on the venue. But we did employ a lot of tricks, so to speak, to get things going quickly.
But and even complicated your earlier statement about when you scaled CrowdRx, 50 states is really, health department rules in all of these different, municipalities, especially at that time. I mean, we were involved in all those NCAA championships, and running an event in Berkeley was completely different than running an event in Birmingham, Alabama.
100%. And now you're getting into political territory as well, which overlays this whole thing and sort of styles. And remember, we had the bubbles. We did stuff for the NHL. They're in the bubble, and the guys would sneak out at night.
Yeah.
It's really, it was really all over the map.
You kind of put it in the back of your head. You forget about it because we're back to normal, and we're running events, and we're looking at today's challenges. And look, we just went through a 2-week period where there are some serious things happening around the world, and Mexico and what we did in Venezuela, and now in Iran, and what we saw in Austin. Does these security topics affect your teams as much as it is affecting ours?
Well, I think something we don't talk about in the public, but I think we talk about in our meetings, and certainly there's a great mass gathering meeting that actually Connor Fitzpatrick has run in the years past, where we talk about terrorism and what can be done to an assembly of people, whether it's at a U.S. Open final or whether it's the leaders that assembled in Iran. It makes for a vulnerable state where you could spread something that could be catastrophic. I think my number one fear is bioterrorism. Again, we don't talk about it much, but a dirty bomb is really something that is small, tough to detect, and can be lethal if you have enough people together. So I think behind the scenes, we all are thinking about this. I jump and scream because, ironically, in the medical world, our vehicles could be weaponized, right? We're going in and out of these venues with large boxes and stretchers. And my number one thing, and it's just a security issue, just because you see Steve, John Doe driving the ambulance in every day for the entire season, it doesn't mean you're not checking that vehicle. It doesn't mean you're waving them through. And if there's an emergency in the building, you still check that vehicle, because they're not going to do something bad by just driving in routinely. There's going to be something around it. So always be on your guard. After 9/11, people were so heightened and intense, and you know this a lot better. And it just faded back to complacency again in many places.
Yeah, it's a really good point, because there's a balance between trying to provide that urgent care and that service, and ensuring that Steve has not been compromised. We've seen really good people, because of socioeconomic impact and geopolitical impact, become bad guys. Yes. The New Orleans New Year's Eve incident last year. This guy was, just a vet, and a good guy, and something happens in his life, and he's mowing down people in New Orleans.
Right, and if somebody could be a bad guy his whole life and pretend to be a good guy for 2 years at your venue. Yeah. But he's just waiting to be a bad guy when everyone thinks he's a good guy. Right. And so we do talk about that. We have mass gathering plans. Obviously, in a mass casualty, that is a huge stress on our medical team, because we can't staff up for a mass casualty. No. Again, a reason to have the huge backing of our GMR company for those situations, and to put some redundancy in there.
Where do you see event medical or event medicine evolving over the next 5 to 10 years?
I think the technology is going to get cheaper and smaller. So I think you're going to have, when you get even 20,000 people for a Knick game, you're going to have a more robust medical office. When we started, my first office at Yankee Stadium was a glorified broom closet, literally. Right. And now we have big offices. We have a lot more medicine there. We have paramedics that can actually treat. We have emergency medical doctors there, and that's pretty much all of our venues. I think that will get better and better, and I think it will spread to across the country to maybe some smaller venues that had smaller budgets and make it better. I think that there may be a blowback on this liability side, I hope, with the tort reform. I hope to see that happen, which will free up some dollars for some of these venues.
Yeah.
The defibrillator technology is also great, the automatic defibrillators, and we have those at all of our venues. You have to keep those up to speed. There's sadly now bleeding kits have to be considered, because in a mass casualty, bleeding is one of the number one causes of death. And education has gotten better.
Yeah. I think more education, because we have a lot of resources on site. The security team, the event team, and then there's the medical team, and they've got a particular skill set. And frankly, it's a little intimidating to those of us that don't have the right training. I mean, I remember the youth baseball days, and they said we had to get a defibrillator for the park. And I'm like, great, let's do that. It's a little intimidating. Right. I don't know how to, am I going to go use this thing? I think the training, and I think as even in the security side, we ask the whole event team to be the eyes and ears to help us.
Yes.
And clearly it's the same for the medical team, right? We see something, we're making those calls, and we're trying to, make a space for medical to work on an attendee, a patient. But I think more training, cross training, helping those eyes and ears that we rely on to get you the right information.
Right. So when the call comes in the radio, we try to teach security to give us not just, something's happened, the guy's down. It just give us some details.
Yeah.
Get our response time. I think the other thing, going back to the technology thing, it's enabled some of these tools to be brought down to the level of a layperson, where the automatic defibrillator, with some quick training for your staff, somebody could save someone with that. Because again, they're quicker than medical, depending on, again, the budgets and the numbers at an event.
Right. It's purely a numbers game, right? There's more security staff than there is medical staff.
Yes.
Right? So,
and I've often thought there should be more cross training there.
Yeah.
And I think liability, and you can answer this, we've always been told we don't want our guys involved at all in any security topics, because that's a whole different lane for insurance. So I still think a little cross-training would be helpful. But certainly, if not cross-training, collaboration.
For sure. So you just touched on collaboration. What's the mindset shift that needs to happen to really improve that collaboration?
I would like to see egos be taken out of the equation, and that's easier said than done. I think both medical people and security people are very proud of their work and their position, and they can get their feathers ruffled easily. Yep. I personally, that one of the things I think that's fueled our growth is I don't like organization charts other than for response protocols. I don't like even to be called doctor sometimes. I'm just one of the guys there to help. And whether you're, making popcorn, or you're security, or you're running the stadium, or you're running a first base, we're all on the same team. So I think getting rid of egos and knowing that, Dan, you could hurt me just as much as I could hurt you at a venue if we're not on the same page.
Right.
You say, Andy was, just walking to the guy, and we had called it on the radio as a man down. And I could say, well, Dan's guy didn't even notice and was on the wrong channel, or whatever it is.
Yeah. So. Right. Look, we make a very focused effort to ensure that we have our medical and security people together pre-event and talk about that communication process.
Yes.
And try and make sure that gets out to the broader team. But it's, unfortunately, and something I'll address with our team, I don't think we put as much effort into it as we should.
I agree.
And I think that's a good starting point. Look, I've been the beneficiary of your teams on site, and I'm in a role where if I'm there, I'm an important figure in the event, and I've gone down, or I've had, something happen to a foot or something, and having your team there and being able to assist so that I can keep working has been a huge benefit.
Right. We do a lot of employee health when we're on site, and that's another great way to make friends with everybody. I mean, I've got friends at the Garden that have been there for 30-something years, and I've operated them over the years. I've given them a prescription if they need a little help when they're there. We're there for long periods of time, idle. So why are we not just being good to each other and helping where we can?
For sure. All right. Rapid fire here. One word that defines a well-run event.
Communication.
Most underestimated risk factor in large gatherings.
Terrorism.
One metric every event organizer should track related to medical readiness.
Response time.
One industry change you'd make tomorrow.
Industry change I would make tomorrow. I would say medical legal security integration.
I was gonna go legislation, insurance, but I like it.
It's in the same ballpark.
Yeah, exactly. Dr. Bazos, thank you so much. This has been an absolute pleasure to catch up again and to be able to pick your brain and collaborate. And I'll make an effort on our side to make sure that our teams collaborate better on site.
Great. Thanks for getting these topics out and spreading them out so we can keep, bottom line is patient care, patient safety.
That's right.
And having fun at these events. I have fun at the events. I'm sure you do for the most part. But patient care is not just for the medical side. It's for the security side and the venue side.
I appreciate it, sir. Thank you.
All right. Thank you.